Okay.
I was going to say, I'm not sure we're going to give her the very high.
She said she passed out.
High marks on the nursing.
She kept waking up as she heard me get up. She kept saying, "Are you okay?"
And you say okay, and she went back to sleep, huh?
Yeah, I was like,
I'm not sure we want her for our night nurse.
I'm like, I'm getting
wonderful
Gatorade.
white
The nurses?
here.
Yeah.
Amazing.
Yeah.
But that's just an example of she didn't really need her mom, because her mom did a lot of pre-op work for her in defense of her mom.
She did?
My mom was
Her
the one.
mom's pretty awesome.
She, called Sandy for me, did everything. Got all my doctor's appointments.
Well, we're very excited about having our second patient. If you notice, I don't know if you looked in the mirror this morning, but you see the red flushing?
Yeah.
You see that? That's the estrogen going down. That's the change.
I also started my period yesterday.
Right. In other words, as you know, during your monthly cycle, your estrogen goes up and down. That's the normal cycle of estrogen. And so the fact that you started that period, and again, we appreciate you sharing that with us. Everybody on the internet, so we'd like to tell you.
It's all right.
This is Susan Doe. We'll call you Susan Doe. Just started her period. You can see these are pretty amateurish, right? But the exciting thing about that is, again, just a quick summary. Remember that heavy women, overweight women, have abnormally high estrogen. Generally, as you get heavier, the estrogen level on average goes up. We think that that is why obesity is deadly from the standpoint of breast cancer. So heavier women have more estrogen, and that greater level of estrogen is one of the reasons that heavier women get more breast cancer. And along with not just breast cancer, but heavier women with elevated estrogen have more endometrial cancer, cancer of the womb. Okay? And with that elevated estrogen, there's a higher risk of blood clots. And blood clots in the veins of the legs and going to the heart and death. And one of the neat things, in your case, you said your period just started. We kind of kidded around about that. But that's actually a cause for celebration. Your estrogen is dropping as of yesterday. The surgery is already working.
Right.
The flushing on your cheeks, that's showing that estrogen is changing. And a recent study from Canada, which I think we talked about Tuesday, showed that the risk of breast cancer in gastric bypass patients, women who had gastric bypass, went down by 85%. And so imagine with your 31-minute surgery yesterday, if now the rest of your life you look forward to an 85% lower risk of breast cancer.
Awesome.
Pretty cool. Plus all the other benefits. Yeah. So we want to thank you for toughing it out, to being at home and kind of taking care of yourself and getting your own crackers and things like that, where, you know, everybody else here, we had to kind of rely on the nurses and get the shots and everything. So they did that. Of course, you had the tremendous benefit. It was a lot less expensive for you. And so, of course, the hospital care we're proud of, and some people need that. But the fact that you were able to kind of be kind of that tough John Wayne individualist out there, healthy on your own, we're really proud of you, and we thank you. Are there questions? Anything else left over that you and I should talk about? Anything that's not clear about your medicines or what to do today? Or have you taken off your bandages yet?
Yeah.
They
took them off yesterday.
Good. You might have some bloody fluid or some leakage there. If you think about it, if you had a cut in your skin, it wouldn't be surprising if later today where you're walking around, if you'd fallen and skinned your knee yesterday, if you found some blood on your pants. So we recommend don't wear any of your nice clothes for a couple of days. Just wear some of like an old dark colored sweatshirt or something from Walmart for a couple of bucks. And if that stains it a little bit, don't worry about it. Neither.
I bled a little when we were driving home.
Right, when you're moving around.
It's been fine.
Well, you still could have some. If you do, again, this is not the day for your best white silk blouse.
I won't wear it.
Yeah. If you do have some bleeding, you can put just a regular bandage on, and this is for everyone. You can just put a bandage on it, but we like to take them off because we found that the tape from the bandages causes more scarring than the actual little cut for the surgery. So I think that's better.
I didn't see any bruising.
Good.
Everything looks good.
Good. Nothing like being young and healthy for having surgery. If you have a choice, always choose to be young.
Oh, of course.
I don't think we have a choice with that. Mama, we were just asking, any other questions? Anything else that we should go over? Are you happy, comfortable that you understand what's going on?
They
And
had mentioned last night for her to take baby, or not baby.
Children's Tylenol?
Tylenol, it's not in the book. So if it is, I mean,
Yeah.
Janice and I looked through it.
Right, and we're not crazy about any post-op pain medicine because
So
they
if
all.
it's okay, don't.
Right, she doesn't need it, but when pushed up against the wall to come up with something, we came up with baby Tylenol because it's a small dose. We're not crazy about it, and it is something you could use if you're having pain. Probably the first thing is just give us a call.
It's liquid?
It's baby liquid Tylenol, right?
So no adult.
You actually, again, it's. I have to be careful how I say this because I'm worried that it'll get out on the internet, and there are things that happen on the internet on our mailing list that I can't control. Like there are people out there, they love those elite drops. There's something called elite drops where you add to your water instead of drinking Gatorade, and I have been railing against elite drops for years, but I can't stop it. It's like crabgrass.
Now why don't you like the drops?
Well, because they're the equivalent of eating a cracker.
Oh,
Well,
okay.
it's less than what you get in a cracker.
Right.
So people are sending away to a company, they pay, $4 for a little bit of this, and basically what it's got in it is a tiny bit of salt. And they add it to water and they go, whoa, I got elite drops. And I don't mind that, it's not, but I constantly say, there's not much to elite drops. You could get the same equivalent value by eating a cracker. And why not carry a cracker with you and then drink whatever's available as opposed to, making a Mr. Science mix of elite drops to drink with you and things like that. But it's a good example that I'm worried about what I say because of how it gets interpreted. So, is Tylenol good for you? No. Can you take Tylenol willy-nilly after the MGB? No. What if you took one Tylenol? Is it like Fred Sanford on Sanford and Son, where he clutches his chest and says, Elizabeth, I'm coming to join you after one Tylenol? No, it's more like a cigarette. One cigarette by itself is really not that dangerous. So one Tylenol is not going to be the end of the world. But in general, I want to advise my patients, stay away from aspirin and Tylenol and Motrin. And I've actually gotten a cell phone call one time where my phone went off and I got in and I heard kind of a woman screaming in the background, Dr. Rutledge, Dr. Rutledge. And I go, who is this? This is Susie Smith. I had your surgery several years ago, and I'm in the hospital. They're trying to give me a Tylenol. Talk to the nurse, please help me. So I go, hi. And so one Tylenol, if your doctor in the hospital is wound up and feels like you desperately need a Tylenol, one Tylenol is not going to hurt you. But in general, lots of people feel confident they can just take all the Tylenol they want, and we don't want that.
So what do you
And
do
then is
for
that
kids?
forever?
Yes.
Okay, so it's long.
Like, remember in clinic we had some post-op patients. Do you remember that from Tuesday?
Yeah.
Several of them had brought their labs for me to look at. And what I'd like to tell you is when I looked at their lab studies, many of them, in fact, every single one of them in clinic on Tuesday had abnormal liver function tests.
From?
The surgery. The surgery is wonderful in that it burns abnormal fat out of your liver. So most of our patients have fatty liver because they have fat on their tummy and they have fat on their hips and fat in their liver.
Wouldn't that depend, though, how long they've carried the weight?
It's highly variable, so there are some people who never get fatty liver and are overweight, and there's some people who get a lot of fatty liver because they're diabetes or their cholesterol medicine, so it's variable. But if you just want to go across the board, 95% of patients have fatty liver. Now, your daughter's liver was gorgeous.
Well, because she's only been carrying for...
Your liver looked perfect.
Well, I mean,
Thank you.
well, because she's
You-
young, and she's only been heavy for maybe 46 years.
Right. But now, that doesn't mean anything. She could still have fatty liver. I mean, it's one of those things. It comes and goes. But if you just want to say across the board,
Okay.
most people who are heavy have fatty liver. Now, the surgery is wonderful because most patients who have my surgery, the fatty liver resolves because of the surgery.
Okay.
This is good. But there's a trick. There's a trap. Just like every time you give with one hand, you take back with the other.
Right.
Okay? So what we find is, for the rest of your life after the surgery, there's a mild elevation in the liver function test, a little irritation. It's a little bothered by burning the fat out of the liver. So we don't want to be giving any other toxic things that hurt the liver. So alcohol, Tylenol, diflucan, those kind of drugs which we know harm the liver, we want to hold, pull back, and not use.
So
Now-
what do you do for a headache then, if you can't take Tylenol? What do
Take
you
my name in vain and just suffer.
do? Come visit.
Use the head-on.
No substitute?
No, there's no substitute.
The
Now,
head-on
if head-on's worthless, but if you want to do it, it's okay. Yeah, it works like sugar pills work. I mean, there are a lot of things that work if you believe it. You know, so there's no question. Like a placebo works in many cases to treat a lot of things. But head-on, if you blind people and have head-on with head-on stuff in it and a fake head-on which has sugar water in it, they both work equally well. So if you want to get head-on, it's okay. Just
For these younger girls, though,
Yeah.
that are going to have it, and let's say, you know, menstrual cycles, you've got stuff going on that's aside from the stomach,
tough.
that is, you know...
Too bad.
You're just going to have to gut it out.
Well, in other words, what would be great with this surgery is everything I told you was good news. I would wish that I could say, you're going to lose weight, your diabetes is going to go away, your sleep apnea is going to go away, you're going to get rid of your atrial fibrillation, you're not going to get breast cancer. Nothing but good. It's like Christmas.
Right.
Just toys and treats for everybody and candy, and it's just, oh, no.
Right.
I give, I take. I give, I take. I give, I take. Okay, so lots of good things, and I don't like to talk about the bad things. I don't want to talk about it. But one of the bad things is that you can get an ulcer after the surgery.
Right.
Okay, the biggest complication, the thing we fear the most, the thing that the beautiful young pregnant lady had in front of you in clinic on Tuesday, so you can see it happen in front of you. There's a woman who looked like she had a great result, right? But she was also suffering from a complication. That's the surgery. The surgery has great results, but it also has complications. One of the complications, the biggest complication, the one we fear probably the most, is gastritis or an ulcer. Your stomach gets irritated, and we can tell you right where that happens. It's right where you sew the stomach to the intestine. They get ulcers and gastritis there because God didn't mean that kind of connection to happen.
Right.
So it sometimes gets upset. It sometimes gets irritated. It sometimes gets annoyed. And we know how to cause that in people, even if you don't have my surgery. Take an aspirin. Okay? So people who take baby aspirins to protect their heart, have you heard of that, where you take a
Yes.
baby aspirin to protect your heart? Those people, 6% per year, will have bleeding complications from that baby aspirin.
Baby aspirin?
Just from a baby aspirin. Studies from England, 6% per year have bleeding. And we're exactly the same as a baby aspirin. Ours is about 5%. Okay, now what does that mean? Does it mean you shouldn't take that baby aspirin? Well, most people think if you need to be protected from a heart attack, that risk is worth the
I
benefit.
was going to say, ulcer, heart attack.
Yeah. And not only that, we know how to protect you from getting that ulcer if you have our MGB. Don't take aspirin. Don't drink alcohol. Don't smoke cigarettes, because those all increase your chances of ulcer. And we know how to put the seatbelt on. We know how to put the seatbelt. We know how to protect you from a car wreck. You wear a seatbelt. We know how to protect you from ulcers. Eat yogurt. Eat a healthy diet with fresh fruits and vegetables. Take your fiber.
What if there's somebody who has problems with migraines? What do you do then as far as...
There are two comments about that. First of all, if you have migraines, most of the time we make them better or cure them with the surgery,
Okay.
just like diabetes. But there is a risk. There's not a guarantee of cure of migraines.
Sure.
It's something like 85 or 95% of our migraine sufferers get better. And in fact, that's such a good question. I'm going to stop the video recorders and record a special little video, if you don't mind, just on headaches.
That's fine.
Is that okay? But I'm going to answer that. That's a good question. So let me just stop this for a second.